Bismillahirrahmanirrahim. Hello everybody. And my talk today is about delivery room management of the normal newborn. In this lecture, I'm going to cover the following topics: establishment and maintenance of respiration, assessment of the newborn's condition, care of the umbilical cord, care of the eyes, stabilization of the baby's temperature, identification of the infant, monitoring, documentation. Our learning outcomes is to describe and carry out the evidence-based routine care of the newborn baby at the time of birth, to know the components of Apgar score, to recognize the care of the umbilical cord, to identify how to provide eye care, to recognize the methods of stabilization of the baby's temperature, and to identify how to start kangaroo mother care in the delivery room, and to describe how to identify the infant after birth. Let's start with a case scenario. An infant is delivered to a primigravida mother by spontaneous vertex delivery at term. Immediately after birth, the infant cries well and appears normal. The infant is dried and then the cord is clamped. The infant has a lot of vernix. And now we came to the following questions. When should the infant be given to the mother? When should the mother be encouraged to put the infant to her breast? Should the vernix be washed out immediately after delivery? What do you think of the method of cord care in this infant? Why is it important that eye prophylaxis is not forgotten? In the first 24 hours of life, this is a significant time due to critical transition from the intrauterine to extrauterine life. The vast majority of babies need no intervention at birth other than routine normal care that occurs in 90% of cases. If this is done well, they vastly reduce the likelihood of problem. We are aware of the neonatal resuscitation program, and we know that it is very important to establish respiration immediately after birth. So in 90% of cases, this occurs spontaneously without assistance. But in 10% of cases, you have to give the resuscitation efforts, starting with initial resuscitation, steps of resuscitation, and positive pressure ventilation, and combined chest compression and positive pressure ventilation. Lastly, medication if there is no adequate response. When we assess the newborn's condition in the delivery room, we came to the Apgar score. Apgar score was originally derived from a great pioneer in neonatology, Dr. Virginia Apgar, in 1952. This score was used to assess the baby's condition and is taken at 1 minute and 5 minutes. And now it is extended to 10 minutes as well. It is inappropriate to use the Apgar score alone to establish the diagnosis of asphyxia. You have to have other criteria, as you will know in the lecture of hypoxic ischemic encephalopathy, that there are 4 criteria to diagnose asphyxia. One of it may be Apgar score. Also, we should know that Apgar score does not predict individual neonatal mortality or neurological outcome, and it should not be used for that purpose. Apgar score is determined by evaluation of the newborn baby on a 5 simple criteria on a scale from 0 to 2 and summing up the 5 values. The resulting Apgar score ranging from 0 in the worst case scenario to 10 in the best case scenario. And this is the Apgar score. On the left-hand side, you will see the 5 items we assess in the Apgar score. The appearance of the baby, the pulse, the grimace, that is a response to a catheter in the nostril of the baby, the activity, and respiration. And you can see that for each item, you give the baby a score of 0, 1, or 2. For appearance, if the baby is bluish all over, you give 0. If he is bluish on the extremities, but he is pink on the body, you give 1. And if it's totally pink, you give 2. For the pulse, if there is no heart rate, you give 0. If the heart rate is below 100, you give 1. If it is 100 or more, you give 2. If there is no response to a catheter in the nostril, you give 0. And if there is weak grimace when there is stimulation, you give 1. And if the baby cries and pulls away when stimulated, you give 2. For activity, if there is no activity, the baby is limp, meaning that he is not moving at all and he has a very poor muscle tone, like a frog position, you give 0. If there is some flexion of the arms, you give 1. If the arms are totally flexed and the legs resist extension, you give 2. For respiration, if there is no respiratory effort, you give 0. If it is weak, irregular, gasping breathing, you give 1. And if there is strong cry and regular breathing, you give 2. So the worst case, you will receive 0 for all items and a total score of 0. And the best case will receive a score of 10. So if the score is between 0 and 3, this is critically low, and this means poor baby's condition at birth. If it is between 4 and 6, this is fairly low. And if it is above 6, that's 7 to 10, this indicates that the baby has a good general condition. You should also do an initial brief physical examination to the newborn soon after delivery. The examination should include the vital findings, including the heart rate, respiratory rate, the length, weight, head circumference, general appearance, extremities movement, heart-lung auscultation, palpation of the femoral pulsations to exclude coarctation of the aorta, and looking for evidence of birth trauma or congenital malformations. You should also assess the gestational age, and we have the new Ballard score, where you can evaluate if the baby is full term or preterm and what is the approximate gestational age of this baby, according to certain criteria in the muscle tone and in the physical exam of the newborn. All these measures should be plotted on a size for gestational age chart, and you can see this in your book and on the website. During this routine examination, problems can be identified and, if appropriate, referred for investigation, specialist assessment and treatment, as well as being fully discussed with the parents. And this is a graph showing the weight for gestational age chart. And you can see this is on the x-axis. You can see the gestational age starting from 24 weeks to 46 weeks. And on the y-axis, you can see the weight in grams starting from 500 to 5,000 grams. And you can see if you know the gestational age from the Ballard score, and if you weigh the baby, then you can put the baby into one of 3 categories. Either small for gestational age, that's below the 10th percentile. This the low line, this is the 10th percentile. If the baby is below this, this is called small for gestational age. And if it is between the 10th and 90th percentile, this is appropriate for gestational age. And if it is more than 90th percentile, this is large for gestational age. Let us take an example. If you have a baby who is 34 weeks gestational age and his weight is 2,000 grams, 34 weeks, 2,000 grams, he is appropriate for gestational age. If you have another baby at 34 weeks and he's weighing 1,000 grams, he is small for gestational age. And you have another baby is weighing 3,500 grams at 34 weeks, he is large for gestational age. And this is how we classify our newborn babies into one of three categories according to the gestational age and to the weight. We come now to the umbilical cord care. The umbilical cord should be clamped with surgical forceps about 1 minute after birth. And this is the new concept in managing the umbilical cord. We do what's called delayed cord clamping, that we wait for 1 minute before we clamp the umbilical cord so that the baby will receive a large amount of blood, and this will prevent the baby from being hemodynamically unstable or developing anemia after birth. So this is a very important step, and it is endorsed by all societies now, and it is practiced widely all over the world. Any baby who does not require resuscitation, you should do delayed cord clamping. The delay after birth before clamping the cord allows the infant to receive some extra blood from the placenta. This extra blood will help prevent iron deficiency anemia later in the first year of life. You should use sterile clamps. The first is placed 2.5 to 3 centimeters from the abdomen, and the second is placed 1 centimeter from the first. And then we cut the cord with blunt sterile scissors between the two clamps. And this picture shows on the left hand side, you can see the umbilical cord containing blood, and on the right hand side you can see the umbilical cord after delayed cord clamping, and you can see that the umbilical cord is empty from blood. That's the baby receive this amount of blood, which is important to prevent iron deficiency anemia and hemodynamic instability. And this is how we cut the umbilical cord between two clamps, and this should be done at least 2.5 to 3 centimeters from the abdominal wall. Now we come to the umbilical cord care. You should examine the umbilical cord structure, and the umbilical cord stump should have 2 arteries and 1 vein. And you can differentiate easily between the vein and the artery because the vein is thin-walled and is larger than the artery. The artery is has a thicker wall and it is narrower. Once the infant's cord has been clamped, the surgical forceps can be replaced with a sterile disposable plastic cord clamp and sterile cord tie. So you can use either the cord clamp, plastic cord clamp like what we do in Egypt, or in some countries they use a sterile cord tie. And then you observe for oozing of blood, because if you don't clamp the umbilical cord perfectly, the baby may ooze blood and develop anemia. And this is a plastic cord clamp applied on the umbilical cord stump. How we care for the umbilical cord? We should paint the end of the umbilical stump with alcohol, and we should clean the cord at the base of the cord firstly, then the stump from down to up with one direction, and cleaning the cord's clamp. Let the cord exposed, not covered with diapers, to leave the cord dry. And you should assess the cord for healing and signs of infection later on, like erythema, edema, and tenderness. The WHO, that is the World Health Organization, propagates dry cord care. That means that you don't apply any medications on the umbilical cord, and you leave the umbilical cord stump to dry and fall after that. And they advise against the use of ointments or lotions or alcohol over the umbilical cord and leave the umbilical stump exposed to air. And you should not cover the cord with bandage. You should leave it with cord air. However, chlorhexidine application is recommended in regions of the world where poor hygiene is there, like in the developing countries, because of the risk of infection of the umbilical cord, which is omphalitis or neonatal sepsis. To avoid that, you have to apply chlorhexidine lotion. Usually, the umbilical stump will fall between 1 to 2 weeks after delivery. And this is a picture of a clean, dry umbilical stump without sepsis, without infection. Eye care. The most common infectious agents transferred to the newborn from vaginal canal include chlamydia trachomatis and Neisseria gonorrhea. You have to clean the eyes immediately after birth with swab soaked in warm, sterile water, then using separate swab for each eye, and clean from medial side to the lateral side. You then should apply prophylactic eye drops or ointment within 1 hour after birth. And there are several medications that has been used for prevention of infection of the eye in newborn babies, including erythromycin ointment, silver nitrate eye drops, bovidine iodine eye drops, tetracycline ointment, gentamicin and tobramycin eye drops and eye ointment. And this is how we apply the antibiotic ointment to the eye within 1 hour from birth. Vitamin K prophylaxis is very important to prevent hemorrhagic disease of the newborn. So after delivery, we have to give 1 milligram vitamin K by intramuscular injection. For preterm babies, you can give a lower dose like 0.5 milligram, and it is given by intramuscular injection in the anterolateral aspect of the mid-thigh, the vastus lateralis muscle. And some countries advocate the use of oral vitamin K. However, intramuscular vitamin K is much better because number one, you are sure that the baby have received the vitamin K. Number two, it's only a single dose. However, for oral application, you have to give several doses, and then we have the problem with compliance. So if the mother is ignorant and they forget to give the baby the vitamin K, then hemorrhagic disease of the newborn can occur. So in Egypt, we usually give vitamin K by intramuscular injection in the anterolateral aspect of the thigh. And this is how we give the vitamin K injection. Hepatitis B should be administered to all newborns within the first 24 hours after birth, and this is endorsed by the National Vaccination Program in Egypt. If the mother is hepatitis B carrier, then the baby should receive not only the vaccine, but also the hepatitis B immunoglobulin, and this should occur within 12 hours after within 12 hours of birth. And the baby should receive the vaccine in one thigh and the immunoglobulin on the other thigh. Stabilization of the baby's temperature is very important after birth. Since delivery room temperature is lower than that in utero, drying and wrapping the baby in dry, warm, sterile flannel blanket immediately after birth is helping to prevent the drop in the baby's temperature. Appropriate clothing of the baby for ambient temperature is recommended. This means 1 to 2 layers of clothes more than adults. Wrap in warm blanket. Cover the head with stockinette cap, and the head cap is very important to prevent heat loss from the scalp, because the scalp is very vascular and the head represents a very large surface area. It represents 25% of the surface area of the newborn. Also, you should avoid overwrapping in the summertime because this can lead to hyperthermia. So we don't like our babies to be hypothermic or hyperthermic. They should be in a neutral environment with normothermia. That's the temperature between 36.5 to 37.5. And this is a picture of a newborn, and he is adequately closed and wrapped and has a head cap as well. The delivery room the temperature should be between 25 to 28 degrees centigrade, and there should be no draughts, and it should be clean and warm. After in birth, if the baby is delivered, you should dry him with a clean, dry, warm cloth. Then transfer the infant in a second warm, dry towel after drying and removing the wet towel. Put the babies on the mother abdomen or chest in a warm, clean, dry surface. This is very important. If the baby does not require resuscitation, we do kangaroo mother care or skin-to-skin care in the delivery room, that we put the baby on the mother's chest between the breasts and we cover both with a blanket. And this is very important, not only for maintenance of body temperature, but also for the psychology of the baby and the mother, and also for starting initiation of breastfeeding, and for relieving the pain and stress in the newborn. You should cover the baby's head with a cap. You should use a radiant warmer in the delivery room so that the baby will not get hypothermic. And you should maintain the baby temperature and evaluate the baby temperature in the delivery room. And afterwards, it should be between 36.5 to 37.5. And this is a picture of a radiant warmer. And the baby should be put under the heater to maintain the body temperature, and it's better to use a servo control, that a sensor put on the abdomen of the baby to feel the baby's temperature, and the heater will then be activated if the baby gets colder and stops when the baby gets warmer. And this is how we dry the baby in the delivery room. Kangaroo mother care or skin-to-skin contact is essential for the mother to see and hold her infant as soon as possible after delivery. If the baby appears to be normal and healthy, the infant can be placed on the mother's abdomen while it to be dried. The 1-minute Apgar score is assessed, the umbilical cord clamped, and the initial examination made. The infant should then be moved into the kangaroo position between the mother's breast. This initial contact between the mother and her infant is an important stage in bonding. And this is a beautiful picture of a baby just born, and he was put on the kangaroo mother care or skin-to-skin contact immediately after birth in the delivery room. Initiation of breastfeeding is very important, because breastfeeding has many advantages for the mother and for the baby. So early and exclusive breastfeeding should be encouraged within 1 hour after birth. The baby receives immunological advantages of the colostrum from early feeding. Sucking reflex is most intense in the first 45 minutes through 2nd hour after birth. That's why we should initiate breastfeeding within 1 hour after birth. Newborn infants should be placed and remain in direct skin-to-skin contact with their mothers immediately after birth. Encourage in unrestricted frequency and duration of breastfeeding. Adequate feeding involves 8 to 12 feeds in the first 24 hours. Check the baby's position and attachment when the baby is feeding. Keep the mother and the baby together for as long as possible after delivery. Bathing. There is no need for routine bathing all infant after delivery to remove the vernix, because the vernix is really a protective layer that protects the baby's skin from infection and from injury. The WHO recommends delayed baby's first bath for at least 6 hours and ideally 24 hours after birth. Delaying bathing may help a baby develop her microbiome, that is the normal bacteria flora, which may help in part in disease prevention. The only indication for the infant to be washed and bathed soon after birth is severe meconium staining, contamination with blood or maternal stool. Also, babies from hepatitis B, hepatitis C, and HIV positive mothers, because if you give intramuscular injection, you can introduce the virus into the baby. A sick and high risk infant should never be bathed soon after delivery. This is a vernix caseosa. It's a normal layer that covers the baby, and this is lubricant, so it facilitates the birth process, and it's also protective because it contains antimicrobial and lysozymes, and it protects the baby, the delicate baby skin after delivery. You don't have to remove this layer, and it goes by itself later on. So you should avoid bathing within the first 6 hours after birth, and you should not remove this layer. Identification of the baby after birth is very important for medical legal reasons, and we have two items that should be done. We use baby's footprint, and also we put identity bracelets on the ankle or the wrist of the baby with the name of the mother and the baby if he's a boy or girl, and his hospital information number and the date of birth. You should monitor the baby's breathing, color, and warmth after birth every 15 minutes in the first several hours after birth. Don't leave the mother and the baby alone in the first few hours after birth. Your baby should be monitored. And you have to document everything. You have to document that on a paper form, which include a checklist. And you should put the Apgar score at 1 minute and 5 minutes and maybe at 10 minutes as well. Any action taken to resuscitate the baby, whether initial steps of resuscitation or ample packing or post-pressure ventilation or chest compression or medications. The estimated gestational age of the baby according to the New Ballard score, the birth weight in gram and the head circumference and the length of the baby in centimeters, whether the baby looks healthy or sick, any abnormality or clinical problems noticed, identity of the baby with the footprint, administration of vitamin K, prophylaxis, and eye prophylaxis as well. When a normal infant can be discharged from the hospital? This is a very important question. Most newborn babies can be discharged after 6 hours. Before discharging the infant from the hospital, you should ask yourself the following questions. Does the infant appear normal, active, and healthy? Does the infant feed well? If the infant is more than 5 days old, if he's gaining weight or not, because usually in the first 3 to 5 days after birth, there is physiologic weight loss. After that, the baby is gaining weight. Can the mother feed and care for her infant? If the infant is jaundiced or not, if the infant has been immunized or not, and does the infant weigh more than 2 kilos or not. If the answer is reassuring for all these questions, then the baby can be discharged from the hospital, but follow-up visits should occur within 48 hours to assess the baby for other problems that may evolve, like jaundice, for example. Back to our case. When should the infant be given to his mother? The answer is that it should be the baby should be given to his mother immediately after birth if he does not require resuscitation. So the baby is dried, the cord is cut, and the umbilical cord is determined, and then the baby is put on kangaroo mother care with his mother. When should the mother be encouraged to put the baby to her breast? As soon as she wants to. And this is usually should occur within 1 hour after birth. She should encourage the kangaroo mother care, and the baby is put on the breast before the placenta is delivered as well. Should the vernix be washed out immediately after delivery? The answer is no. Vernix is a protective layer and should not be removed immediately after birth, and the baby should not be bathed within the first 6 to 24 hours after birth. What do you think of the method of cord care in this infant? The cord should be cleaned with chlorhexidine solution if you are in a developing country, and it should not be covered with dressing, or you can apply the WHO recommendation for dry cord care without any application of any antiseptic, any ointments, or antibiotics or lotions or alcohol on the umbilical cord stump if you are in a developed country. Why is it important that eye prophylaxis is not forgotten? Eye prophylaxis is very important because there are infections like chlamydia trachomatis and Neisseria gonorrhea that can lead to conjunctivitis, so you should apply antibiotic ointment to the eye like tetracycline or erythromycin ointment. This should be applied within 1 hour after birth. So in summary, the first 24 hours of life is very significant time due to critical transition from intrauterine to extrauterine life. An initial brief physical examination should be done to assess the infant soon after birth. Apgar score should be assessed at 1 and 5 minutes after birth. Prevention of hypothermia and the monitoring of the baby is a very important step in care of the baby after birth. Delayed cord clamping and cord care, vitamin K and eye prophylaxis, kangaroo mother care and initiation of breastfeeding, postpone the first bath till 24 hours after birth, identification of the newborn using the footprint or the bracelets, and documentation of everything done for the baby. So now I have brainstorming questions for you. How can a baby be kept warm after delivery? Mention 5 items. Describe what skin-to-skin contact means, or kangaroo mother care. When should the umbilical cord be clamped? These are the references. If you want to read more and more about our topic, we have included 5 important references you can refer to in your study. Thank you very much for your understanding. Thank you.